Hello everyone, presenting a case of ossified yellow ligament which is present at the level of D11 D12. This is axial MRI section at the level of D11 D12. So this is a close-up image and you can see there is a calcification on NCCT. These are axial cuts at the level of D12 L1. So you can easily appreciate calcification. So initially lamina was identified after removing soft tissue, and drilling was initially started with cutting burr. After localization with the help of C-arm. So localization is important. So then I shifted to diamond drill. So drilling is important in this case because the main part of the surgery is drilling only. So my intention was to drill to contralateral first. So if you can appreciate, so I'm drilling right now to the contralateral side. So major part of base of spinous process was drilled so that we can reach easily to the contralateral side, and there is a good space. So you can appreciate midline and contralateral area. So now I am drilling at the midline level. So now I'm trying to come to the ipsilateral side. So this is cranial and caudal extent of the drilling, as well as medial and lateral extent of the drilling. This is cranial end. So now I am drilling from the cranial to caudal. In midline, because I have already drilled contralateral bone part, which was already very thick. So right now I am drilling in midline and towards ipsilateral side. So because this is a thick yellow ligament, calcified one, so obviously there is a very narrow space, so we have to use a thin Garrison punch initially just to negotiate. Once there is enough space, then we can use bigger Garrison, and we all know this is a dorsal region, so we have to be very careful. So now ligamentum flavum, the healthy ligamentum flavum, that is visible now, but there is still a very thick bone, so which I am trying to take out with the help of this very sleek Garrison punch. So after opening this ligamentum flavum, fat is visible, so just trying to coagulate. There are few epidural vessels. So hemostasis is also important. So now you can see, even after that much drilling on contralateral side, there is still a thick bone still remaining behind, so I am trying to thin it out with the help of diamond drill so that I can decompress contralateral side also. I have to grip this bone, I have to make it thin. So this is how you can build this. The building has to be very controlled one, that is the junction. So once bone is thinned out, so you can use now the bigger carousel. Sac which is visible, ligamentum is being removed. This is the lower end or the caudal end. This is the cranial end. Because now we have created a good space, so now we can use bigger carousel in this case at this level particularly. The decompression has to be wide, and we have to take care not to grasp or get hold dura, which is quite possible in such cases. So this is the root. Contralateral ligamentum level. So now you can see the extent. This is the cranial end from pedicle. Now this is caudal end.